Getting a copper IUD birth control is like getting a Moscow Mule cup up your coochie, a Moscow Mule cup. Welcome back. It's your host, Halli Smith, for another episode of Girl Core, where I talk about those taboo, awkward subjects that nobody wants to discuss because it's too embarrassing. One of my favorite phrases that my dad uses whenever I mention something like periods, health, he says to me, oh, Halli, no, that's too locker room. Locker room talk. I don't want to hear it. Locker room talk is the talk you have behind closed walls when you don't want anybody else to hear it. Comes from back in the day when guys would be in the locker room talking about chicks, sports, and whatever happens in locker rooms. He would say, locker room talk, ladies. And that means this is TMI, and he didn't want to hear it. I just happened to build my entire personality off of locker room talk and start a podcast where I'll give you guys all the advice talking about locker room subjects because you know what? It should be. And I still do it. Even when my dad tells me, like, this is locker room, Halli, I don't want to hear this. I make him hear it because I'm like, some things need to be normalized, like periods, for example. I'll talk about it with my mom right there, and my dad's there, and I'm like, yeah, my period was super heavy. I need to switch to a different tampon, or I need a different pad. And I always mention these things in front of my dad because he always squeals and gets like, super awkward. And he just wants to shut down the conversation. But I'm like, no, the more we normalize conversations, it's when it gets better for everybody else. The more knowledge that men have about women's health and even just intimacy in general is good knowledge to have. I don't ever cringe away from these things just because for some reason the little feminist inside me loves to bring it out into the open. I don't want to hide these things. We know that women bleed. We know that women like sex. We know that women love intimacy. There's this bad trope that women don't want to have intimacy. There's always guys complaining, oh, my girlfriend, my wife doesn't have a high drive. She never wants to do it. She's never in the mood. That is not true. Women love to do it. Women love to explore that intimate side with ourselves and with our partners. But it has to be done in the right way. It's very intimidating. The female body is very misunderstood. And it's also something that we're always told to shove in the closet and not talk about. Women were told, don't talk about your periods. Like the woman's body and women's health is nasty when it's not. Because women's health is a problem for women and men. It's a problem for everybody. The more that we address it, the better it becomes for everybody. When you're an adult, you want to be able to openly express your needs in the bedroom. You want to have this conversation without somebody being, oh, ew, gross. It is crazy how shameful men and women feel scared if they have to buy tampons or protection or maybe lube. They feel super awkward and shamed by the people around them. It actually showed that men are less likely to pick up protection because of where it's placed in a store. Mostly stores place forms of protection for intimate care in a very seeable public area because they say it helps with theft. But honestly, there's not a lot of high cases that these condoms are being stolen. But they do show in a lot of studies that when you put these forms of protection too much in the open, it makes people shameful and scared, and then they just don't pick it up and instead use no protection when they get intimate. Studies have shown that grocery stores and markets, if they do want to sell more forms of protection, need to put it in a slightly more low-key hidden spot. Product placement matters. And it actually showed too that because our society has so much negative energy towards the menstrual cycle that you need to hide it and not talk about it, women need to be really secretive about if we're bleeding. And they've taught that to men that it's gross and it's weird. It actually has created a negative side effect for men and women. And that being that men and women are less likely to purchase protection for intimacy because it's next to period care, because it's next to tampons and yeast infection cream and extra large maxi pads. It makes people not want to buy the other products around it because it creates a negative feeling within them. And it's crazy to think that just any form of menstrual product in an aisle can make somebody not want to buy anything around it because it makes them think that's gross or it's bad or it's weird. Apparently, that correlation is actually worse for the companies that are selling the forms of protection because it makes people associate bad energy with using protection. They see the tampons, they see the pads, and they're like, ugh, gross. I don't want to do this. I just won't use one. If we can reduce the shame in our society, we need to have more locker room talk every day with our friends and in our relationships about menstrual cycles and periods and protection and intimacy. The more we normalize it, the less awkward it's going to get when we have to buy these things. We're just going to learn how to own it and be like, yeah, I am bleeding right now. Okay. I need extra large fake pads with the wings because this shit is flowing. And a guy can feel confident enough to go pick up freaking 20 pack of protection. Okay. Some Trojans, and he's not going to feel really shameful or embarrassed about it, whether it's a female clerk or male clerk. When you talk about those taboo subjects, such as your period and going in depth into your intimacy and what you like, what you dislike, even just using protection. What type of protection do you like to use? Having those awkward conversation fuels a society that feels less shameful, which is why I am going to tell you guys about my pap smear I had to do this last week. Yep, I got one, and I'm going to talk about it because you guys should too. Because sadly, cervical cancer for women is on the rise. First things first, if you don't know what a pap smear is, it's pretty much just when we go to our gynecologist and they're going to do a little bit of scrape from the cervix. They're going to take a sample and test your cervix, make sure everything's good. There's no cancer, there's no STDs. You can do a full all around health check from women's cervix. So I had to go get that. And if you've never had a pap smear before, you need to get one, especially if you're over the age of 20, 21. That's usually advised when women should have one. But honestly, if you're sexually active or on birth control, important to stay on top of your health, especially as women. Trust me, I was scared of doing this appointment, okay? I get it. I was really nervous. I was shaking. I was really uncomfortable. And I took a really big edible beforehand to help me relax. But before I get into that, we need to rewind a little. At first, I wasn't going to get my pap smear. I was actually supposed to get my IUD switched and removed a couple months ago. You guys might have heard me talk about it on my TikTok, being like, guys, getting my IUD removed. Then I changed my mind because I heard about the side effects of having a copper IUD and I was nervous about making my skin bad. I already deal with hormonal acne and acne issues. And lots of people said the copper IUD can mess up your acne and things like that. Obviously, every birth control has side effects, but usually that wins over pregnancy because I don't want that. But nonetheless, I canceled my appointment because I was like, you know what? I'm going to take some time and figure out what I can do. Do I switch to the same birth control and suck it up? Then I had made this new appointment a month ago. Mind you, oh, American health insurance sucks. I called so many different doctor's offices. I really wanted to switch my birth control ASAP. I could not get an appointment anywhere. Everybody was like, we don't take new patients. The insurance doesn't take that. Or we just don't have availability for another 6 months, 3 months, 4 months. Finally, I found one place that had availability in 1 month. So I was like, that looks like it's the best I'm getting to switch my birth control. It's coming up on my year that my birth control is going to be inactive since I got it. So I need to get this done. I scheduled the appointment and I was also scared of getting my IUD out. I was really worried about the pain relief because the first time I got my IUD, they gave me a high dosage like pain reliever that I had to put up my kitty cat, this little pill. And then they also gave me a high dosage pain reliever pill that I took orally. So I took two forms of pain relief before that first IUD removal. The second place that I now scheduled my IUD at, they are supposed to be an all women's health clinic. And I was like, yes, this is perfect. Women know women. They'll be really intuitive and really care about what I'm going through. I call them and I'm like, hey, I have my IUD removal and I just want to check with my doctor if there's any way I can get any form of pain relief, some type of medication before the appointment. And they were like, oh, yeah, we'll have to check back with the doctor and call you. So they called me and they're like, yeah, we can't give you any form of pain relief before the appointment because you're a first time user. But I specifically went to this clinic because you guys are a all women's clinic, health centered. I thought you guys would be the most caring and understanding of the pain that women go through during IUD removal and insertion, especially doing the super big copper IUD. And they're like, yeah, we totally understand that, but that's because of our laws when it comes to the healthcare system. That's not our fault. And I was super upset. Literally a day or two before my appointment, the night before, TikTok. I go on a deep dive. Have you guys ever gone on a bad deep dive on TikTok? If you're stressing about something, your For You page is going to somehow know and then show you everything you're stressing about for hours. You're going to fall into a TikTok doom scroll on whatever scary subject that makes you anxious. And that day, it was me, my upcoming IUD and birth control switch. And I, of course, see a video about a lady talking about how bad the non-hormonal birth controls have been for her. She had her IUD, but it was too big and then it snapped inside of her. And I was like, what a freaking IUD can snap? And then I see a TikTok video saying getting a copper IUD birth control is like getting a Moscow Mule cup up your coochie, a Moscow Mule cup. And then I looked up the size of it, guys. It's 39 millimeters. That is huge. I think the small birth control I have in right now, my IUD, is like 29 millimeters. So 38, 39, that is really big. And that is for women who have gone through childbirth. I was like really freaking the frick out before this appointment for my switch because I was just like, I don't want that up there. I'm scared. The size of the copper IUD is insane until finally I see a video talking about how in Europe, in Canada, in other countries besides the United States, they have another form of copper IUDs. They have a smaller copper IUD that's not like a Moscow mule cup going up your coochie. Instead, they have tiny little ones that are made specifically for women who haven't given birth but still want a non hormonal IUD. So I was like, wait, hold the freaking phone, pause it, because I literally have a Swedish husband and I can go to Sweden and get the non hormonal IUD that's tiny. And they have it. It's called the Mona Lisa. There are actually 3 different sizes you can get of the non hormonal copper IUD outside of the US. They have the really tiny version, they have a slightly bigger version, and then they have the full big one, like the size that we have, the Paragard IUD, as we call it, that is huge and made for women that have given birth. But that's because they're super fertile. So they want to make sure there's a lot of copper, it's a lot stronger, whereas some women don't need that big of a copper IUD. So I was like, holy shit, I'm gonna take my opportunity. I'm gonna cancel my freaking IUD appointment that I have for the next day because I'm not getting a Moscow mule cup up my coochie. I'm scared. I don't wanna go through that pain. And I was already freaking out about this appointment of having to switch my birth control and getting mad at my husband because I was just like, you don't have to go through this. You're a man. It must be so freaking nice. Why do I have to go through this? This is unfair. I hate this. I love being a woman, but I hate having to deal with healthcare as a woman because it sucks. So I was really freaking happy when I discovered that you can get a different type of copper IUD outside of the United States. But ladies, if you live in the US, there is a silver lining that you can actually get that super small copper IUD, aka the Mona Lisa, the brand. You can order it online and ask to have your doctor, your gynecologist, actually use that IUD and insert it inside you. The only thing is, usually your doctor is going to not be super on board. They have to sign a waiver because they're not trained with these IUDs, the Mona Lisa in the US. Lots of gynecologists that have done it and signed off and did it for women when they ordered the IUD online and then did it in office. He said it was exactly like inserting the Paragard IUD. It's just a little bit smaller, but it was the same technique and method. They did have to talk them into it a little bit. They were a little bit nervous and they did have to sign a waiver in case anything went wrong because technically the doctor is not trained with this specific IUD. So, ladies, if you do want to look into getting that smaller copper IUD, you can order it online and possibly find a gynecologist that will insert it for you. Do not insert it yourself unless you're a licensed doctor who understands what you're doing. Do not ever try to insert your own IUD that you find online. And if you do order the IUD online, do not open the box because it's a sterile object that has already been sterilized. You do not want to open the package, contaminate it. Don't even open the box. Just wait until you get to the doctor's office. So once I realized that I could get a different form of an IUD later on when I'm in Europe, I decided instead to schedule a pap smear because I was like, I don't want to cancel the appointment. I feel bad. And I've been needing to get a pap smear, which I was going to schedule after this IUD. So in the morning, I call up my office. I'm like, okay, hey, yeah, not doing the birth control. Don't want a Paragard copper IUD. I'm going to wait on that. Instead, I'd like to do a pap smear and just do an overall health check. Okay. Next morning, I was super anxious for this doctor's appointment. I had a pap smear once before this, but I was younger and I honestly don't remember anything really from that first experience except for just being really uncomfortable. So this time I was just really in my head and I think I'm turning into a bit of a hypochondriac. And if you don't know what that means, it pretty much means you're super scared of health issues and hyper aware of any ailments on your body. I used to be the least caring person. I would get a big ass blister on my ankle from playing tennis. I wouldn't cover it. I didn't care. Whatever. I got a cut. Okay, whatever. Just keep going. I don't need a band aid. I almost lost my leg in France to blood poisoning because of a scooter accident. I got hit on the back of my ankle, which led to a lot of doctor's appointments, emergency healthcare, and being in pain in a foreign country was not fun and slightly turned me into a hypochondriac. And then I also had another little incident with fainting because I had strep throat and had to get a really big shot. And then I was really scared after that. So it turned me into a little bit of a hypochondriac, the giant accident with my ankle in France, and then the side note of getting strep throat and then having to get that giant shot in my butt cheek and then passing out because of the pain messed me up in a few ways. Bit of a hypochondriac problem. I didn't sleep well the night before, went on my TikTok deep dive. I then wake up the next morning and I'm just like, oh, okay. I'm just gonna do a little bit of that weed. I'm just gonna do a little bit of gardening. So I pulled out my little gardening candy. It's like a little gummy, but it's like a big chunk of a gummy. I was running late before the appointment, so I quickly grabbed it and just took a big bite out of it. And I was like, maybe that was too much of that candy. I might be a little more up in the sky high than I thought I was gonna be. But I was like, whatever, I'll just be super calm for my pap smear. It's cool. My man drives me, so I just am chilling in the car. I get out, I go check into my appointment. I'm trying to relax. I'm just scrolling on some TikTok while I'm waiting for my name to be called. And then they call me in, and I'm like, "Okay, I'm feeling good. I'm feeling mellow. Good idea, Hallie. Yeah, I took just the right amount of that little candy." I'm sitting there. She's asking me questions. "You sexually active? How many partners do you have?" These are typically the questions you get asked before the pap smear starts. So I'm answering those. Any health problems? When she asked me these questions, I was starting to slowly get a little bit more up there, a little bit higher. I think my eyes are starting to get a little bit red because anytime I garden, my eyes get immediately red. And the doctor's asking me if I smoke. And I'm like, obviously, can't you see me? But I was like, "Okay, no, you can't even tell, Hallie, you're fine." I'm relaxed, and then she's like, "Okay, that's about all my questions. We'll get the next doctor in here to come see you." She leaves. I'm chilling in there. I'm just relaxed. Then my doctor comes in. She's gonna do the full process of the pap smear. She's, "All right, sweetie, just sit on the table and put your legs in the stirrups." And the stirrups are like these metal kind of footholds that you put your feet in, and you just strap them in there, and you're laying back. I have my little hospital gown on. I hid my underwear in my bag before she came into the room. Anytime women go to the gynecologist, we hide our underwear. We stuff it somewhere they're never gonna see. I don't know why we do it, but we do. We're like ashamed of our underwear at the gynecologist. We put it in our purse, we put it in a bag, we just put it out of sight, out of mind. And you would think if our doctor about to see our entire coochie, we wouldn't be worried about them seeing our pair of underwear, but for some reason, we all get super scared and paranoid that they're gonna judge the underwear. And she was just like, "Okay, we're just gonna feel the girlies. I heard you had a breast augmentation, so I just wanna check on that and also just on your breast health." So she felt around here, did her little checking, and then she was like, "Okay, I just need to take your heart rate." At this point before the pap smear, my heart started beating so fast because I started getting so nervous. Like I started literally almost shaking in fear. And so she goes behind there to start taking my heartbeat, and I just knew she's gonna mention because my heart is racing right now. So she puts it on there, and she was like, "Whoop, okay, just maybe breathe a little bit. It's okay." And I was like, "I know. I'm just a little bit nervous." And she's like, "No need." She's like, "Just take a second. You're okay." And the other doctor, she comes over. She's like, "Yeah, just breathe. We're going to take a deep breath in and deep breath out." And I was trying to calm down, but my heart rate would not go down. So she's, "Oh, it's okay. Just lay down. We're going to start the process." Then my gynecologist sits down and pulls out her equipment. It wasn't your typical hospital grade surgical equipment that's just plain silver. Hers were like chrome highlighter purple. They had this super cool ass design all over scalpels and tweezers and all these tools that she was going to use. And that's when I knew I trusted this woman because I was like, if you've got freaking highlighter chrome equipment. And that's when I knew this gynecologist, she was the shit. Because if you've got limited edition scalpel and tweezers and all this shit, like you ordered this equipment yourself, you are a badass bitch. You know what you're doing if you've got special skins on your medical equipment. I'm sitting back trying to relax, and she's like, "It's okay, sweetie." And I started to feel really high. My eyes were probably red as the devil's dick. They were redder than red, just squinty. I'm starting to feel not too relaxed, and I'm just like heart's beating. And she was like, "It's okay, sweetie. I can feel your tenseness from down here." She's like, "She's gonna make it more uncomfortable for you." So the nurse comes over and she starts petting my head, being like, "It's okay, sweetie. It's okay. Just calm down." And I'm like, "Okay, yes." And she's like, "Sweetie, it's okay. I know it's scary getting a pap smear. Everybody's a little bit nervous, but you have nothing to worry about." And I was like, by the way, my voice was literally cracking, shaking. I was like, "My last gynecologist told me that my cervix is a little bit lower, just so you know." And she was like, "It's okay, sweetie. Just come a little bit more forward. That's not a problem. That just means I got to have you a little bit closer to the edge." So I scoot my butt forward in my medical gown while my nurse is still like petting my hair. And she's, "It's okay. Now breathe in with me. You're just going to feel slight tension." And then I don't know, she slipped something in, but then she starts playing 20 questions because she's trying to throw me off. She's trying to get me focused on her and not what she's doing inside my kitty cat. So she's, "Where do you live, sweetie?" And I was so nervous. I couldn't even think. I was like, "I don't know." And she was like, "Oh, okay. And you said you were married? When did you get married?" "Oh, he's from Sweden." So she's trying to play 20 questions, but my mind's going blank. I'm trying to focus on her, but I'm really focused on what she's doing down there. She was good. She had her shit down. So she just kept rapid fire asking question after question. That eventually I was like, "Okay, I'm just going to focus on her questions right now because she's going in." So I'm answering her questions. I feel her doing some shit. She's like, "Okay, yeah, and that's nice. That sounds like fun." And then she's just doing her job though. She just at the same time like working on a car under there. Finally, though, she then just pulls out her hands. She literally felt like she had like two hands in me. Probably not two hands. It was more just like probably two little tweezers. But after she pulled out her hand, she was like, "Okay, that's it. You're all done, sweetie." And I was like, "Wait, hold up. Wait, really? That was it? The pap smear's done?" And she was like, "Yeah." "Wasn't that not scary?" And I was like, "Okay, wait, now I feel like a dramatic ass baby because I was literally over here just quivering, shaking on the table. And it was that easy. I was a little bit embarrassed, but I was at the same time, you know what? It happens to the best of us, Hallie. And she was like, you have nothing to be embarrassed of. She's, I get it. It's a scary experience. Sometimes they're using too big of equipment down there that can hurt and stretch you out, especially if you've never had children. She's, but I'm experienced and I'm used to this. So it was actually a really good pap smear experience. I was so happy because I was honestly really nervous. And yes, I did feel slight pressure inside of myself, but it wasn't like somebody was cutting me or doing anything super painful down there. If you do have a pap smear come back abnormal and you find out you have an STD, you do need to call anybody that you've hooked up with since you knew about the STD. You have to. If you're mature enough to go to Pound Town, you're mature enough to take care of your business and let them know what's going on, okay? But if you gave somebody an STD, you're allowed to give a call, not a text, because that's inconsiderate and they probably need to talk to you. They probably need to ask you some questions. I would do it over the phone. If you're scared and you know that person really hates you and you're like, I don't want them to know it was me, they do have anonymous apps that you can text somebody if you gave them an STD. You can look into one of those sites and text the people that you're scared of telling that you gave them an STD if you want to do it anonymously. But you need to most likely do it over the phone. They're going to want to talk to you. They're going to want to hear what it is, when did you find out, and then proceed with the steps themselves. And if you do tell somebody that you gave them an STD, they might be mad. They might be a little bit reactive. Just let it wash right over you. This is our first time hearing it. It's very scary. There's a lot of bad things that people think about when they think of STDs. There's so many fears. So do not react poorly if they're a little bit upset or annoyed or scared. That's completely normal, just like you probably were when you first found out. So remember that. Put yourselves in their shoes, be polite, let them say what they need to say. And then if they really do get mean, though, you could be like, I'm sorry. I told you I've done my part. That's all I can do. And then just end the phone call. But for the most part, you got to hear them out. People are going to be reactive. You have to tell your partners what's going on. You have to talk to your boyfriend, husband, whatever it may be. You have to discuss it. And if you do find out you have an STD and it's something maybe that you have to live with long term, you need to be safe and talk to your next future partners about it. I know you're going to be like, I don't want to tell them that I have an STD. Just tell them, get it out there in the open. Plenty of people can have sex still with an STD using a form of protection. So you're not getting that skin to skin contact and possibly catching something or giving it to somebody. Because last thing you want to do is be responsible for knowingly giving somebody an STD. Besides that being a really messed up, mean thing to do to somebody, it's also really bad karma. And I believe in karma, whether you do or don't, the energy, God, whatever you believe in of higher power or just moral compass, do not ever lie to anybody about having an STD or any form of anything. You need to tell people, you need to be mature. And it's really not that big of a deal. Yes, some people might be put off at first. They might be like, oh, I'm a little nervous of maybe hooking up with you just because I don't want to catch that. But talk to them about it. Be like, there's this and this that we can do to be safe. People need answers. They're going to have questions. So if you do tell somebody you have an STD, be prepared to have some Q&A. They're going to want to know, how do we do this safely? How do I make sure I don't catch it? Is it really severe? Is it really dangerous? How do you handle it? So be prepared to answer those questions and don't get mad at somebody if maybe they're a little bit nervous at first and maybe want to hook up with somebody who has an STD. It can be nerve wracking. You just need to process that and be respectful because it is scary, but you can do it in a safe manner depending on what STD you might have. My aunt was one of the first doctors to work with AIDS patients during the epidemic and learned a lot about how AIDS works. People were really scared at the time. One of my aunt's close friends and patients contracted AIDS back in the early days before we knew a lot about it. But he safely used protection no matter what when he was having intimacy with his partner, with his husband. And his husband never ever got AIDS. They were very safe about it. He was very careful. And you can too. If you have any form of sexually transmitted disease, any STD, you can still have intimacy and practice in safe ways, but you still do have a responsibility to tell them, even if you're being as safe as you can be, they need to know that. Remember, in life, whether you're super scared about getting a pap smear or anything that you're anxious and nervous about, at the end of the day, after getting this pap smear and being so stressed out beforehand about it and so nervous and then realizing it wasn't even that bad, is that worrying is just suffering twice. You're just making yourself so anxious and so scared over something you don't even know the results of. You don't even know what's going to happen. So remind yourself, if you're worrying about something and you're really stressed and anxious, it's not going to help fix the problem. It's just going to make it worse. You're just suffering twice before the thing even happens and then during when you're actually having the thing happen. So just keep that in your head. Stay calm. I did not stay calm during my pap smear. I was shaking. I wish I practiced this myself before this pap smear because I got myself so worked up that after that pap smear appointment, when I was walking to the car, my husband was waiting for me. I just started bawling my eyes out after my pap smear appointment. I was so anxious. I was so stressed. I had so much built up anxiety and energy inside of me that I just cried and cried when we drove home. And then when I got home, I still was crying for the next 2 hours on and off. I was just hysterically crying after my appointment because it was just so stressful and it got so much in my head. And it just made me realize how worked up I got myself. So when you catch yourself being over the top and working yourself up, try to calm down, take a breather, practice a meditation, maybe get a hug. Hugging is so good for anxiety and moods of stress and worrying. Hugging releases oxytocin and dopamine. So hug your friends, hug your family, hug your boyfriend, your girlfriend, or even your cat or your dog. You can hug your pet and still release and feel that level of oxytocin if you're really stressed about something and hopefully not work yourself up as intensely as I did before this pap smear because crying for the rest of the day really took it out of me. I was exhausted, I was drained mentally, physically, and emotionally. All right, guys, it's the best time of the show. Q&A time. All right, first question of the day. Hey, my long distance boyfriend is coming over tonight and I just started my period, but we are planning on doing stuff. Any tips? Okay, if your period started but you still want to go to Pound Town with your partner, super easy fix. First of all, menstrual disc. These are these little bendy, squishy discs. They look like a cup and they're flat. And this you just pinch and squeeze and then push up just like a tampon and it slips up. And this is just like putting a plug in a bathtub. It's just gonna cover the seal so that it doesn't drip out and you're not gonna have any leakage using a menstrual disc. I love them. They barely feel them and they're very easy to take out and get in. You just hook your finger and pull it to get it out. Or you can use a menstrual sponge. These are literal sponges. They look like a cleaning sponge. You put it inside and it's gonna soak up all of the leakage so that when you're using the pink water bottle in and out, it's not gonna drip out, they're not gonna feel it, and it makes it really nice and comfortable for you and your partner. That way you guys don't have to worry about any staining on the blankets. But always, if you are going to Pound Town with your partner on your period, make sure you put down some towels just in case. I always have maybe some baby wipes in my nightstand just to clean up if you notice a little bit of blood. It's okay, it's normal. Those are two of my favorite forms to protect from leakage that you can use. As well, back in the day when I was gonna hook up with my partner and I was on my period and I was in a long distance relationship, I chugged dry powder of gelatin mix, like from Jello, because I read on Google that would help condense the blood flow. And that's something that I did when I was in a long distance relationship and my period started, but I wanted to go to Pound Town when we met up, is I took the dry powder from Jello packets and ate the dry gelatin because I read on Google that would stop your period and it would stop the flow, okay? Having to drink a dry pack of Jello powder is really gross. If you've ever tried to take just dry Jello powder, it gets sticky and gooey in your mouth. And it's really not a fun texture. It's super goopy and gummy Jello texture. It was gross. And I don't really think it did that much to stop my period. I maybe noticed it was slightly lighter, but not worth it to take all those dry gelatin packets. You can give it a try if you're really desperate. You can try taking the dry Jello packets to stop your period if you want to hook up and go to Pound Town, even though you're on your flow. You can just use a simple menstrual disc or menstrual sponge. It's a lot easier. Sometimes they say drinking things with turmeric or ginger can help suppress it. There's a lot of different forms, and I've actually made a TikTok talking about the multiple things that I have tried. But I honestly think at this age, I think the best thing just to use is a menstrual disc or a sponge. It's the easiest, simplest way. Okay, this next one isn't a question, it's more of a funny statement, but I posted a cute little brunch picture on my Instagram story with some truffle fries and my little cowgirl hat, and somebody swiped up on it, and I was just laughing at this. One of you guys said, truffle fries and a good dick appointment after is all a girl needs. And I said, amen to this. Yes, blessed be. Truffle fries and Pound Town is what just makes a girl happy. Maybe throw in a little Caesar salad and you're gonna have that kitty cat wide open for business. All right, next question. I lost my V card literally 5 hours ago, but I still feel a little bit of discomfort when I walk around. Is this okay? Is this normal? This is completely normal. It's just like if you work out and you don't stretch beforehand, your body's gonna be extra sore afterwards. Same thing if you go to Pound Town after your first time, or even if you were a little more rough than normal. You might feel discomfort afterwards, but more like a kind of like a soreness, like after a workout, that same type of soreness, tenderness down there, especially if you're newer. You were probably a little bit more tense, a little bit more tight. That muscle wasn't as relaxed, so you put more strain on it. This will usually pass after a day, maybe even 2 days if it was your first time. And even if you went to a little bit of rougher pound town, you might feel some discomfort for a bit, but this also should usually pass after 2 days. If you continue to notice severe pain though, after going to pound town, maybe even a little bit of bleeding, and you're like, oof, I don't know, and it's been over 3 days, I would maybe make an appointment with your gynecologist and check up on what's going on. There just could be something else. You might have maybe tore something a little bit inside of there. Maybe something else is going on, but it's definitely good to look into. But you shouldn't be too stressed out. It is pretty normal and it should pass. Next question. My man said he would like to be woken up with a little bit of brain sometimes, a little bit of action, a little blowy, but I don't know what to do. Do I just go straight down there and take off the boxers and get to work? Or do I slowly wake him up? I don't know what to do, but I want to try it. Okay, if you're a little bit nervous about waking up your partner with some pink water bottle, all right, if you're nervous about waking up your partner with a little bit of brain, okay, a little bit of action on the pink water bottle, do not stress. If your partner gave you consent beforehand to try this, I would say the best thing to do is gradually wake them up a little bit, brush their hair a little bit back, give them a light peck, a little smooch, and then you can trail your way down and start giving them some fun brain or whisper in their ear in a sultry way, wake up, baby. And then make your way down, kind of just give them a light alertness so that they don't wake up jumping up scared. Once you lightly give them a little bit of whispering or smooches or pecks, then you can just lightly, slowly take your time. I think it's really fun if you are trying to wake up your partner with some fun time to go slow, really build it up, especially because they're probably drowsy and sleepy. So gradually wake them up. But it's a really fun surprise thing to do if you're in a relationship or with your partner. Either side would love it. All right, guys, that wraps up another amazing episode of Girl Core. If you want to listen more, you can always catch me on Wednesdays for episodes on Hero Hero, where I do side little episodes like edging techniques, fingering, and blowjobs, where I do individual topics each episode. But if not, you can catch me next Sunday for another episode of Girl Core.